What can I do for you?
I have this here in my wrist.
Oh, this?
No, just this. You see the lump?
This. Okay.
Yeah. So
Okay, for a long time?
For a long time, yeah.
Is it painful?
No, it's
No.
not. No, my wrist gets very tired if I'm using, if I'm on computer a lot.
Okay, it's getting tired.
Yeah.
Okay.
My wrist
And
gets tired. So and it's quite big, and I think there's another one growing beside it.
growing here. Do you use your wrist a lot
When
for
I'm
your
typing,
work,
yeah.
or
Yeah,
you
yeah.
type all day long?
Yeah. A
And
lot.
this wrist
This
is
one
okay.
Yeah.
This is a so here. Do you feel any sensation, like any tightness, any pain, nothing?
No, not really. No.
Not really.
No.
Okay. So what is your diagnosis here? Lung, and it goes a little bit to pericardium, right? Lung and pericardium. That is our step one. What can we do to balance?
We have 6 systems.
Yeah, we have 6 systems. That's very good. Is there any meridian can balance lung and pericardium same time? Do you remember the case for the shoulder? I told you there is one very good meridian.
Liver.
Yeah. Liver balance lung by which system? Liver and lung balance each other by system 5. Very good. And then liver balance pericardium by system 1. Almost. Okay? So in this case, I would just pick liver. Right? Which side? Opposite side. Very good. So could you please remove your, take your shoe off and socks off? What would be another option? If I don't want to ask her remove the shoe and I don't want to kneel down and blah blah blah, what can I do? I can needle the arm. But if I want to do arm, if I want to solve an arm problem with arm meridian, there is only one system can do that. Who that is?
3.
System 3, very good. Now what? What would I do? Large intestine to balance the lung and Sanjiao to balance pericardium. Then I would needle on large intestine, Sanjiao, and in between. Okay? That's another option. But let's do liver. Did I put needles?
It's not good for you.
Okay, I need you to give me your high your yes. Thank you. You know what? I think I'm still here. Take a chair. I can take this one. Yeah, because you'll be more comfortable. Yes, perfect. Everybody more comfortable then. Okay, so when you look at this location, you see it's on the wrist and a little bit proximal to the wrist. So I'm going to palpate on the the liver here. Is it tender where I put? Little bit.
Mm-hmm.
Here also?
Yeah.
Okay. If I go higher, here? Yeah. Oh, okay.
Yep.
Yep. This one?
Yeah.
Ah, okay. This? Okay. Yeah, this is exactly the arch. So one needle here. And you see that on the pericardium, it does affect the tendon. So I'm also going to needle in the tendon.
But we won't tell her before.
No, we won't tell her.
What are you going to do?
Don't worry. Is it painful so far?
No.
Ah, thank you. Here also? No, not too much.
Not too much.
Yeah. So now I'm looking for the tendon here. Okay. Let me test this one. Tender?
More sore than tender, just depressing.
Just the pressing.
Yeah.
This
Yeah.
one.
Yeah,
Yeah,
yeah.
there's still
Yeah.
one more here.
Yeah.
Okay. Now you can move your wrist, but because you didn't feel anything before, we will see if you feel anything different. But just move it. Move your wrist and thumb and yeah. Of course, we don't expect that the bump will disappear like within seconds. Sometimes the patients they feel like it's something is moving or it's getting softer. So before when I pushed, you're more used to me to push, but this one is still a little hard. This one is not too bad actually. But
So they could actually disappear, yeah?
they could, but not in one treatment.
Yeah.
Yes, because this is it's a tissue. Tissue is changed. The structure of the tissue has changed.
Yeah.
So it will take time for your body to remodel it to normal. Okay.
Okay.
So you will need pretty often regular treatment, so that we keep on telling your body you need to do something about that. Okay. Now, do you feel, I don't know, any tingling, any warm, anything?
No.
No, yeah, because you didn't feel anything before anyway. So, so typically those patients, if they can get treatment every day, that's the best. Okay, maybe every day for 3 weeks, and then there is no more. Okay, you can massage yourself.
Okay.
You
We
go
will be here for a few days.
for a few days.
few days.
For a few days.
Yeah.
So for the few days, you treat her as many times as you can, even twice a day. It's fine. Okay. And then you teach her. I'm not going to push here, but the way I pushed here before I put the needle, you do the same on yourself.
Oh, okay.
But you need to push very hard. Okay. It's not just a nice massage. Okay.
Yeah.
You have to push strong.
Okay, in those points.
Yeah. When you push, I don't want you to use this because you already use your wrist so much.
Yeah.
So you find something like that. That is that has a
Okay.
nice.
Yeah.
Could be like a razor, something.
Yeah.
And then you hold it like this, and on your foot, then you do like this.
Okay.
You stimulate all the points here.
Okay.
So it will avoid that you do this and then you injure this.
Yeah,
again.